If you've ever dealt with eczema, you know that relentless, frustrating cycle of itching and inflammation all too well. Today, we're diving into something pretty exciting, a non-pharmaceutical approach that actually works at the cellular level to potentially break that cycle for good. We're talking about red light therapy. Let's see how it works. And this, right here, just gets to the heart of it, doesn't it? Eczema isn't just some rash on your skin. It's a constant battle that messes with your sleep, your focus, your whole quality of life. It's that nonstop itch that can feel absolutely impossible to escape. And the struggle, it's incredibly widespread. We're not talking about a small group of people. According to the National Eczema Association, that's how many people in the US alone are desperately looking for real solutions. It's a huge number, and it just goes to show how urgent the need for new, effective approaches really is. So, to get the full picture, here's our game plan. First, we'll really dig into the eczema experience. Then, we'll look at the history of using light as a treatment. After that, we'll get into the nitty-gritty science of how red light works, walk through a super practical user's guide, and then finally, we'll talk about what to really expect in terms of results. Okay, so let's start with the condition itself. Before we can understand how a therapy might fix something, we have to understand the problem it's trying to solve, right? So what is actually going on with your skin during an eczema flare-up? At its core, eczema is really a perfect storm of a few things going wrong. It's a chronic condition where your skin's natural shield, its barrier, is weak. That means moisture gets out easily, and all sorts of irritants can get in. This then triggers your immune system to totally overreact, which leads to that classic miserable cycle of inflammation, intense itching, and redness. The idea of using light for healing is not new at all. It actually goes back centuries. But modern science has taken this general idea of sunlight and refined it into something incredibly specific and targeted. Let's take a look at how we got here. Okay, this is where the two paths really split. The fundamental difference here is the approach. Traditional phototherapy uses UV light, and its goal is basically to suppress the immune system. And yeah, it can work, but it comes with some serious risks. Red light therapy, or photobiomodulation, is completely different. It's not about suppressing anything, it's about stimulating. It uses specific, non-damaging wavelengths to help your own cells repair themselves. So, how exactly does light stimulate repair? It sounds a little like science fiction, right? Well, this next section is where we get into the core science, breaking down the biological process that makes this therapy so unique. All right, the key term you need to know is photobiomodulation. It sounds complicated, but let's break it down. Photo means light, bio means life, and modulation just means to change or regulate. So we're literally using light to change biological processes in a good way, kickstarting repair and calming down inflammation, all without harsh chemicals. The process is actually fascinating. So, specific wavelengths of red and near-infrared light are able to penetrate the skin where they get absorbed by the mitochondria. You can think of these as the tiny power plants inside all of our cells. This absorption gives them a major energy boost, helping them produce more ATP, which is basically cellular fuel. With more fuel in the tank, your cells can repair themselves way more efficiently, which in turn helps bring down inflammation. So the million-dollar question is, what does this cellular energy boost actually do for your skin? Well, it helps turn down the volume on those pro-inflammatory messengers that drive eczema crazy. It boosts collagen to help literally rebuild your skin structure. It improves blood flow to bring in more nutrients, and ultimately, it helps strengthen that weak skin barrier from the inside out. Okay, the science is really cool, but how does this all translate into something you can actually do? This next section is all about the how-to, the nitty-gritty details you need to know to use this effectively and safely. First up, not all light is the same. Think of these as two different tools for two different jobs. Red light, which is around 660 nanometers, is fantastic for surface-level stuff, like repairing the skin barrier or calming down that weepy, angry eczema. Near-infrared light, at 850 nanometers, goes much deeper. It's ideal for targeting that deep-seated inflammation you get with chronic conditions. And honestly, a lot of the best devices will offer both. Now, this is absolutely critical. The success of red light therapy isn't about just vaguely setting in front of a light. It is a science of dosing. The therapeutic dose is a very precise measurement of light energy, and getting that dose right is the absolute key to getting results. This table is basically our playbook. It gives us a really solid data-driven starting point based on what your eczema is actually doing right now. So for acute, weepy skin, the protocol suggests a shorter session, with red light held a bit further away. For that chronic, thickened skin, it calls for a more intense dose with near-infrared light held closer. And for that super sensitive, inflamed skin, like in topical steroid withdrawal, you want a much lower intensity combined wavelength approach. So to put this all into practice, here are 4 simple rules to live by. First, always start with shorter sessions to see how your skin reacts. Second, make sure your skin is clean and totally dry. Any creams can actually block the light. Third, and this one's important, moisturize after your session. This helps hydrate the skin and lock in all the benefits. And finally, remember that consistency is king. Short, regular sessions are way more effective than doing long ones every now and then. All right, so you've got the science, you've got the protocols. But what kind of results can you actually expect to see? And how do you make sure you're staying on the right track? Let's manage some expectations. Okay, this is probably the single most important concept to understand for using red light therapy safely. It's called the biphasic dose response. That's a fancy way of saying that more is not always better. There's a sweet spot, a perfect dose where the therapy works its magic. But if you overdo it, too much time, too much intensity, you can actually stress out your cells and trigger a temporary flare. Finding your skin's sweet spot is the name of the game. Look, this is not an overnight fix. Healing is a process that builds on itself over time. In the first couple of weeks, the first thing you might notice is the itch finally starting to calm down. By weeks 3 and 4, you might see that visible redness decreasing. And then, after a month or 2 of being consistent, you can start to see those real, lasting improvements in skin texture, as that barrier function is finally restored. And let's be really clear here. While red light therapy is an incredibly powerful tool, it's not a magic cure. It gives your skin the cellular energy it needs to repair itself. But it works best when it's just one part of a bigger, holistic approach that includes managing your triggers, your diet, and of course, your stress levels. Finally, just a few crucial safety points. Always talk to a doctor or dermatologist before you start any new therapy, especially when it comes to kids. Be aware that some medications can make your skin more sensitive to light. And please remember, this is a supportive therapy. It is not a replacement for your doctor's care. All of this really leaves us with a final big picture thought. Therapies that don't just put a Band-Aid on symptoms, but instead give our own bodies the tools to heal themselves, well, that feels like a major shift. It really makes you wonder, is harnessing our own biology the future of wellness?